Dr. Deuk here with one of my patients who underwent a Deuk laser disc repair yesterday at the Surgery Center Vieira in Deuk Spine. And she had a L5S1 herniation with back and right leg pain. And some people watch our videos on the day of surgery and they say, well, maybe the patient's not having pain anymore because they had anesthesia. And I tell them, no, we give propofol. Propofol doesn't take pain away. But here she is a day later. How are you feeling today?
I feel great.
All right.
I took no pain medicine yesterday at all.
No pain meds?
Just Tylenol.
Just Tylenol. All right. And do you still have the back pain you had before surgery?
No pain at all.
You had that back pain for how many years?
I had, not for years. I mean, maybe a few years, not
Few
a lot.
years.
Yeah.
Okay.
The sciatica I've had since July, so about 6 months.
All right, so you had back pain for several years, but the leg pain started 6 months ago.
Right.
And you were like living with the back pain, right?
Right.
Why did you choose to live with that back pain?
Well, no, I didn't really have back pain. I mean, maybe if I overdid it, it might hurt a little bit. It was just the sciatica. It started right after I had COVID.
Mm-hmm.
So when I got out of bed from the COVID, it was down my leg, but not bad, where I could still go do everything, grocery shop and do everything.
Yeah.
So but the last month, I don't know what happened.
Well, you see, let's talk about overdoing it, because it's an interesting point. People with back pain will restrict their activities so they don't overdo it and make their back hurt, right?
Right.
Was that you?
No. I have a 2.5-year-old my granddaughter that I take care of.
Mm-hmm.
You know, so the lifting of her, I'm sure didn't help anything. But I didn't really have any issues before that, so
Okay.
you know, I didn't stop doing that just because it hurt. It was really just from when I got out of bed with the COVID that the sciatica was so bad.
All right.
And it was like unbearable the last like week or two that I had.
All right, well, honestly, I don't believe the COVID had anything to do with the herniated disc pushing on your nerve. But,
It's just
you know,
coincidence.
coincidence.
Because I didn't have it before that.
Yeah.
You know?
But nonetheless, your leg pain is gone, right?
Right?
Cured.
I hope so.
Well, it's not going to come back. All right, thank you very much for sharing.
You're
Great
welcome.
to see you.
Thank you.